Terrific, everybody. So this is Kevin Gregory from Health Action Council. I appreciate everyone joining this morning. I wanted to give everybody a quick overview of who Health Action Council is, and then maybe jump into our discussion about discounts and the impact on healthcare costs. So a little bit about Health Action Council. We started in 1983, and our foundation was really based on the quality of care. Today, we've grown to a little over 220 employers, representing both public and private employers across all industries and shapes and sizes around the country. We do three things at Health Action Council. We remain committed to our work in health improvement. We do education, and we also do group purchasing events. And our group purchasing events ultimately allow us to do a lot of the work. It feeds a lot of our data analysis and a lot of the work that we're able to do for our members. I'll share a little quote from one of our members because, me telling you about Health Action Council is really, it's nice, but I think it speaks greater volumes when that comes from one of our members. So with that, today's conversation is really about getting beyond healthcare discounts. And I think that's one of the questions that we were asked about. In Health Action Council, one of the things that we firmly believe in is this notion of asking better questions. And so when we believe about asking better questions, as our quote from Isaac Yu in the middle there, the way you view the issue will be transformed and innovation will start. That's part of a core value that we have here at Health Action Council. So whenever we get stuck, we always like to go back to, well, what's a better question? How can we ask a question? So the first question, since I joined the organization 7 years ago, was what do employers want? So as we were going through and asking, well, what do you really want? Obviously, we're different things, but our primary focus is on quality and healthcare and health-related matters. So what they ultimately kept saying was, we want healthy, happy, productive employees. We offer benefits to achieve this goal. And our medical plan, ultimately, leads us to having that. But what else do you want? And then I said, that's, motherhood and apple pie, we're all about that. So then what else do you really want? And it's really, we want to cut our expenses. Everyone wants to get better prices on it. We'd like to have minimum disruption. We want to make sure that, because with minimal disruption or lower disruption, we can get more productive employees. And the more the disruption we have, it can lower our productivity. Lower productivity, regardless of how much money we can save, does have an impact on our bottom line. And ultimately, we'd like to reduce our stress, because when you look at reducing your stress, it helps minimize and create better outcomes for everybody. So with that in mind, we kept saying, well, then how are most medical vendor decisions being made today? And so that was our next question. How do you decide what is your most, what's most important? And what it really came down to is provider discounts. And it's something that I know, my consultant friends who may be on the phone today, who are in the industry, they do a wonderful job of analyzing. They all have tools. They can measure this. They can figure that out. They all have a resource to do that. And we make decisions on our healthcare plan primarily on provider discounts. So the question that we came up with was asking a better question was, do bigger discounts mean we spend less? And I think that when we think about what that means, do bigger discounts mean we spend less? I go back to a quote that I hear every year from my wonderful wife, and I give this presentation to her before I give it to anybody, and she's given me approval without any question to share this, her quote there, which is, "You won't believe how much money we saved shopping today. Everything was really discounted." And that's on Black Friday of every year. So we don't spend any less money just because everything is really discounted. It's just discounted. And so that was really the foundation of where we started, was what I believe is insanity. It's insane for me to think that we're going to reduce, because it's a fun hobby and it's become a little bit of an annual tradition for our family. And not that I go out at 2:30 in the morning with them, but essentially it's insanity is doing the same thing over and over again. As our friend Dr. Albert Einstein says, Where I believe insanity is selecting a medical vendor based mostly on provider discounts. Yes, we can analyze it. Yes, we can tell you what they're going to be. And yes, there are more things that go into that that really ultimately has an influence on that. And so that's what I say, well, what influences cost then, right? So we believe that quality, we're founded in 1983, really based on quality matters. The location, site of care matter, the community, social determinants, and provider reimbursement. We're not saying provider reimbursements or discounts don't matter, but we're saying it's just part of that overall equation. So when you think about, does healthcare provider quality matter? And in our opinion, and the work that we've done, the simple answer is yes. If you take an overview here, we're a regional leader for the Leapfrog Group, which is a hospital safety scoring organization. We do it in 3 states, Ohio, Minnesota, and Oregon, and we have cousin organizations like ours all over the country that do it in other states. But when you look at this retail cost of an inpatient treatment, discount at hospital 2 seems to be better. You're going to get $2,500 better. But when you look at the quality surcharge that Leapfrog has identified on a B-rated hospital versus an A-rated hospital, your actual cost is going to be your risk adjusted or your quality adjusted cost is really going to be about $650 higher, because the probability of something going wrong at that hospital, you getting your patient getting an infection, other matters that go on, leading to either greater cost ultimately there. So yes, quality matters from a hospital standpoint, and on a risk-adjusted basis or quality-adjusted basis, it definitely matters. But I'm an accountant by trade, so I essentially said, well, that's nice. I'm managing risk by going to A-rated hospital, but do I really get real dollar savings by seeing quality? And our answer to that is, and again, an unqualified yes. And why is that? We took our 2019 data with United Healthcare. As I said, we're in the group purchasing industry. And so we are one of United Healthcare's largest group purchasing partners. And so we essentially said to them, if a patient sees what they call a premium provider, which is high cost, low quality, what is their cost versus if they don't? And so in the end, you can see on a cash basis, it's $350 per member, which is employee per month. So when you factor in all of the dependents and the employees, you're saving $350 a month. If you risk adjust that, for the actuaries and the folks who follow that, you're essentially looking at about, you're going down to 387, or it's 32% lower. So the bottom line is quality matters, if not probably more, in my estimation, than the actual reimbursement rates, because if you can find a way to get your people to see higher quality providers, your costs are going to be lower in the end. So the next question really comes down to is, does site of care matter? Does the location matter? And so when you look at this this is a picture of somebody, looks like a young boy with a skinned up knee. So where should they go for treatment? So sometimes, my wife would say, well, that's a sharp bite. We should really go to the emergency department. And I would say that's really just a skinned knee, so that let's just take them to the urgent care. And so there is a big difference between the two of those, because when you make a decision, a skinned knee is not a shark bite. An emergency room costs $1,700. The urgent care costs $200. That's undiscounted. So the net savings is $1,500. In the end, I'm a big coffee drinker. So I would tell you that gets me about 1,800 cups of Dunkin' Donuts coffee, which is one of my favorites. And so we at Health Action Council recognize that location does matter. So much like the hospital safety grades, which we encourage everyone to put on their intranet, share with them and as many people as possible. As I said, we're a nonprofit organization. Part of our mission and vision is helping people make better decisions. So we built out a website called findtherightcare.org. We promote it. We encourage you to share it. And it has a artificial intelligence-based symptom checker on there that can be ultimately used by everybody, which is from Bowie Health. It's a wonderful resource. So please take advantage of that. So yes, location does matter. I can overcome if I get people to go to the emergency department or use primary care or use minute clinics or quick clinic services that are out there, my costs are going to be significantly better. So another question that we had is, does where people live impact their health plan costs? It was really an interesting question, and we worked with Optum, which is a data organization ultimately owned by United Health Group. But within that, we asked them to do some analysis for us of our data. And we said, well, what's driving that, right? Where are costs different? What can we do? And are the communities the same? And the short answer to that is no. All communities are not the same. Just like each business isn't the same, it's not the same. So I'm looking here at Atlanta, Georgia. We're going to talk a little bit about Houston, Texas after this, and then I'll loop into a conversation about Indianapolis as well. But when you think about what you would do in Atlanta, Georgia, if I had employees there on my benefit plan, I would focus on individual engagement, because essentially, if you look on the right here, negative impact, medication adherence, hypertension to asthma and hypertension. Those lead to inappropriate use of the emergency department, and as a result, drive up costs. So if you can get the folks in Atlanta to focus in on better medication adherence and taking care of their own health, your outcomes are going to be better. A lot of times when we talk about health system attributes down here, when we have payment incentives, a lot of times we're thinking about how do we reward doctors and hospitals for doing the right things. Right now, when we look at what's going on in Atlanta, we would tell you, they're in the 70th percentile. They're doing really well as it relates access to that, and providing provider incentives to make sure that they're doing the things that they should be. So in Atlanta, you want to focus in on engagement, but you don't want to focus in on obesity and addictive behavior. So Ohio, where I am, Wisconsin, we have an obesity problem down in Louisiana. States around the country have different needs. If you're out talking about obesity and addictive behavior issues in Atlanta, it's just not going to resonate with them. Much like the same as that message is not going to kind of sit very well with your people in Houston, Texas as well. But health literacy is some of the basics of what's going on. You have a different population in Houston than you have in Atlanta. So you want to focus in on health literacy and the things that matter there versus anything else. And one of my favorite studies, and I like to go back to this when we talk about provider reimbursement rates and costs and what you're paying for them, because essentially there's a couple of things to think about, right? It's discounts and then what you're paying. We can focus in on, the discount versus the amount paid, but if you just focus in on the amount paid, which is what a RAND survey recently did in Indiana, it basically said employers in Indiana pay 2.17 times the Medicare for the same service, whereas the national average, it was 1.75. It's a long report. It's a really good report. But this was kind of the headline, was that if you're in Indiana, you're paying more. So I said, well, that's interesting. Let's kind of see what's going on and how can Health Action Council get involved with that. So when we looked at our actual results on a per member per month basis, you can see here Indiana is essentially in our lowest quartile. So meaning that it's the most preferred quartile of where it's at. So there's other reasons for then the fact that costs are higher in Indiana, that costs are lower. So essentially, you may have a higher unit cost, but what you're actually paying as a plan sponsor is actually fairly favorable compared to other cities around the country. What could they work on in Indiana? They could work on emergency room utilization. They're doing really, really well on 30-day readmission rates, so the hospital systems are doing great. They're pretty engaged. So when you think about what to do, you change your message based upon where folks are at. So what are social determinants? So so other things, there's a lot of conversation about social determinants and how they impact your plan. And so when you think about social determinants, I went to this, the CDC, and I said, well, what are they, right? And they've outlined them here, which is economic stability at the high end, education, social and community context, health and healthcare, neighborhood and built environment. And when you read a lot of activity around this, what they ultimately come back to is 20% 40% of our healthcare costs are associated with health and healthcare. We spend a lot of time within that focusing in on the amount of money we pay to the providers and not on all of these other items that have an impact on that. And I want to give credit to one of our members, Progressive Insurance, because essentially they're the ones who said it's social determinants are just really, it's social determinants of employment. People, the same thing that prohibit people from coming to work every day. My child is sick, I won't be in. I need to take my parent or grandparent to the doctor. My car's not working. It prevents people from making it to work every day. It's the same thing that impacts their life. It's what I call life, right? Social determinants are the factors that surround you that have a challenge. And so as an employer, as a plan sponsor or a consultant, we have to realize that we have a limited time frame that we're able to engage and talk with people. So if you think about it in any given work week, 24% of it, essentially is at work, give or take, sometimes a little bit more if you're working overtime and sometimes a little bit less, but it's about 24%. About 30% of your time is sleeping. And so about 47, I'll round up to a half your time is free time. So when you're not there, life happens. So other things have an influence over the decisions that you make. And so about how you access care and what you do. So if we break it down in social determinants, what are employers really working on today? Health and healthcare, definitely. You're working on employment, you're working on discrimination issues and making sure, because you're following, the guidelines on that, for sure. I would tell you that the next thing that some employers are getting involved with, and because they're offering volunteer opportunities for civic participation, they're creating bowling teams, they're creating book clubs, they're creating all kinds of ways for people at work to make a really big employer small so it's more comfortable for people and engaging, and they enjoy working at where they're at. Some folks are doing on-site childcare. Some people are subsidizing childcare, and then we have a number of folks that are starting to offer and pay for higher education, whether that's going to college, if folks are just high school graduates, or if they're, if we're looking for going to MBA and other opportunities to continue to lead their education. As we look into the future, and we think about success and where things outside of our industry and that we're not used to seeing has had an impact. So for example, in a couple of states, they've shown that if you deal with food insecurity, housing instability, and the quality of the housing that folks have access to, you actually have a positive impact on healthcare costs. So as well as language and literacy. So the more educated, the things that you're working on to continue to promote that and bring that in, the more of a positive impact you can have on your benefit plans. I think employers will start looking at this today, because yes, you're providing employment, but that doesn't mean that you're addressing food insecurity, housing instability, because all those other life factors that are going around that employee that has to deal with you. So as we look at that, another thing is we talk about generations. Another, a social determinant or a factor that is the younger generation. Here's our question, right? Every generation says they're different. Here's what I would tell you. Is the younger generation correct that they're different? The short answer is yes, they are. But they're not different in the way that they really should be, because Gen Z has a poorer, different health risk profile than Gen X and baby boomers when we were the same age. Bottom line is that Gen Zs are less healthier than us when we were the same age, and they're much more likely to develop chronic illness at a younger age. So when we think about the actuarial age curve starting to spike up or increase at age 50, when we look at our data, when we look at that generation, Gen Z, there's a very high probability that they're going to be dealing with high blood pressure, high cholesterol, diabetes at a much younger age than the rest of us. They're also utilizing, and it's not a negative or a positive, but they're also utilizing mental health benefits at a greater rate, at a significantly greater rate than everybody else. So again, we've had different discussions with various employers about that. It's just a notice to it. So if you're when again, based upon discounts and what you're paying, if you're solely looking at it from that lens, it's what else is driving that. So our next question, does health literacy matter? So when we think about health literacy, does that matter? And so I will go through this and say, look, you decide which is better. Here's the facts on the page. We got a single parent. They have 2 children. They're making $15 an hour. Child's not feeling well on a Sunday afternoon, and it's January 1st. Your plan design and all of that is sitting on the right-hand side here. And so you could figure out that, hey, if I go to the emergency department, that single parent's gonna have to come up with $1,350. If they go to the urgent care, they're gonna have to come up with $150. So what happens? Well, I think you're not asking the right question first, right? Because this comes down to health literacy. Do most people know what that even means? Copay, co-insurance. So when you look at what's going on here, just like my wife tells me, she is very witty and very direct with me, but no one wants to think or talk about health insurance every day other than us, right? We're on this call because we care about it. It matters to us. We understand it. It's our job. It's what we get paid to do. The overwhelming amount of people only want to care about it when they need it. So what we have to do is make sure that people understand how it works, what they're doing, and then this way, when we teach them and give them better education, when the moment of truth comes and it's time for them to make a better decision about where to go, it's not always going to be the best decision. We just want to make a better decision. Then we hope that as we continue to educate them, they can make better decisions. So the simple answer here, and I'll talk about the social determinants, right? There's other factors, what I call life. I added a little bonus item here at the bottom that we may not think about. The hospital offers a payment plan of $10 a month because of this single parent's income. So what happens? What really happens more often than all of us understand is that that single parent will go to the emergency department on January 1st, and they'll probably go again in January, because once they go twice, they've met their out-of-pocket maximum, and in their world, they're essentially getting free health care for the rest of the year, and they're paying $10 a month. Because they can't afford it, the hospital has them on a payment plan, and that's what they can afford in their budget. Essentially, that's 2 hours after taxes. That's that's about 1.5, 2 hours of work. If I have to come up with $150, that means that I'm working 20 hours that month just to pay off one urgent care visit. So the way we structure our plan and all of the things that happen around us, right? So there's this whole idea of rational behavior and versus irrational behavior, and we build plans, but life goes on around us in order that has an influence on what we do. So I wanted to share that with you and understanding that. So we started today talking about questions. So and that's really our belief, because the question was, what do you want? Healthy, happy employees. What else, right? I want to manage my costs. I want to do all these different things. So here's some suggested questions to get you started that basically go back to, really, do discounts matter? Is it the primary way or the exclusive way that I'm going to be evaluating my medical vendor? How do you account for provider quality? We've talked about that. How will we influence consumer behavior? What can we do as plan sponsors, as benefits consultants, to influence their behavior? We have to build out better resources and tools to help them. How can we influence leading indicators of health costs? It's nice to get a report that says, you're spending most of your money on diabetes or musculoskeletal or high cholesterol, these problems. The question is, what are the leading indicators of that? And what can you or what can your vendors do to help you? How is your vendor going to get you, your people to hire quality providers? And how can they help you improve health literacy? All of those items will matter and have a positive influence on what your outcome is. Because as I like to say, as we're looking at this, is where do you want to buy your next car, right? So here's the analogy that I like to do, right? In the end, you want to buy it from, Kirk Russell down there at the bottom, kind of selling his car, big discounts and how great they are, and why? Why do you want to buy it from that dealership at the top that's nice and shiny and clean and on the outside it seems seemingly very trustworthy? Because quality, location, and social determinants matter in addition to the discount. So when we think about what we're doing, when you think about where you're at, quality, location, and social determinants matter in addition to discounts. It's the same reason why we buy a car from the nice shiny Mercedes dealers or whatever Honda dealer, wherever it is at the top that you go to, versus buying a big discounted car from the corner lot from this fine gentleman on the screen. So I will stop there for a second and see if there's any questions that people have or things that I can answer for anybody on the phone. All you have to do is, if you want to ask a question, is unmute yourself, and I'm happy to answer it. So I want to thank everybody for joining the call today. I appreciate the time. If you have any follow-up items or questions or items that you would like to know about this, please reach out to us here at Health Action Council. We appreciate your time and support and look forward to answering your questions and continuing to work with everybody. Thanks, everybody.